Now let's talk about pericardium 4. Located 5 Sun, proximal to the anterior space of the wrist joint, most distal wrist crease, between the tendons of the palmaris longus and the flexor carpi radialis muscles. Needling is 0.5 to 1 Sun vertically or 1 to 1.5 Sun obliquely in a proximal direction. How to find pericardium 4? Using the spreading hands technique, we place the little fingers in the center of the anterior wrist joint space and the cubital crease respectively. From the midpoint of this distance, we measure 1 Sun in a distal direction. On this level, locate P4 between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. P4 is located on its ulnar aspect. Special features: Cleft point, major point for acute painful blood stasis in the region of the thorax and the heart. PC4 is a very useful point to use to clear the nutritive level of heat and to stop bleeding. The point also has the ability to calm the spirit. It is used clinically for a variety of conditions involving the organs of the upper abdomen and chest, especially those that also involve bleeding. Clinical examples include coughing, vomiting, or spitting blood and nosebleeds. To be appropriate for these conditions, they should also involve heat in the nutritive level. Other symptoms of nutritive level heat that often respond to treatment with PC4 include inflammation of the mesenteric linings of the upper burner, for example, pleuritis, pericarditis, and inflammation of the mammary glands. This point frees and unblocks the flow of blood in the upper burner and is thus also appropriate for a variety of conditions involving blockage of the coronary arteries, especially when heat is present. Here, it would be helpful to pause and note the differences among the 3 cleft points of the arm yin channels. While it is relatively easy to conceptualize lung 6 as a point that is useful for pain in the chest and lungs with coughing of blood, how does one differentiate the pericardium and heart cleft points? PC4 is more useful for problems with flow in the coronary arteries, a more substantial problem in the blood of the heart. By contrast, heart 6 is more often used for night sweats, a problem often caused by a deficiency of heart blood. The deficiency of heart blood that leads to night sweats can be thought of as involving blockage in the channel, causing problems with the qi transformation of the heart. The heart is often involved more in the functions of the heartbeat and blood movement, while the pericardium is more often associated with problems in the physical muscle and blood supply of the heart organ. When there is deficiency of the heart qi and blood, the mind and spirit can weaken and give rise to fears, fear of surroundings and strangers, as well as a lack of mental stamina. This is a fortifying point and a major point for the spirit of pericardium to restore and reassure those worn down by life, disappointments, loss of blood, and lack of shen. Cleft points are also used in acute situations to stop pain. All cleft points are useful for invigorating or dispersing pain or obstruction along the particular channel on which they are found. As it regulates the blood and moves blood stasis, it is a useful point for chest pain due to blood stagnation or for skin eruptions or where there is a shutting down of goodwill and generosity of spirit to others from accumulated hurt. Pericardium 4 is a gate to a tremendous reserve of energy. One of the strongest points on the body, it can bring peace and serenity to a troubled heart. It can help regulate the rhythm of the heart, as in arrhythmia. Consider this point for generalized apprehension and fear of strangers. PC4 is helpful for neuralgia of the middle forearm, hand, or fingers. It is said to strengthen the mind and bestow mental courage. As the accumulation point, it strengthens the meridian, especially in acute situations, that is, heart or chest pain, or as a result of shock. Helps calm the pericardium-type disturbances arising from long-term emotional hurt. And we often use PC4 with triple burner 7.